Hi, Sophie. Thanks, babe. This light's making me look a little bit. Oh, here we go. Hello, Claire. I can see. How do I invite you? Every week, I swear, I'm trying to work out how to do this. It's ridiculous. Right. So Claire is just joining us. Hello.
Hello.
Hi. How you doing?
I'm good, thank you. You?
Good, yeah, not bad, thank you. Not bad. It's been a bit of a funny week for us all, like that. So, yeah, but we're all here, which is the main thing. Um, so thanks everybody for joining. We have the amazing Claire with us today, and we're talking about Lichen Sclerosus and sort of the mental health ramifications of living with that condition. So just very briefly, for anyone who's not aware of the condition, it's way more common than I realised it was. It affects 1 in 80 women, and it's a skin condition that well, Claire could probably describe this better. From what I understand, it causes the skin to itch and become really painful, and skin confused together as a result. And it's just a generally very, it can be a debilitating condition, which I think a lot of GPs aren't necessarily aware of or don't diagnose early enough. So Claire was diagnosed in her 40s with it, at the same time as being diagnosed with vulval cancer. Is that right, Claire? So do you want to tell us a little bit about your experience of living with LS, and what the experience of dealing with it, what sort of symptoms you've had, and the journey towards diagnosis, because it came so many years after you first started living with it?
Well, my first, I suppose looking back, once I was diagnosed, the first symptoms I had, I must have been in nursery school. So I must have been 4 or 5 years old. I remember that I couldn't sit very long on the chair. I always used to get told off from the teachers, and also my mum actually, for being a fidget. I was always called a fidget growing up, because at that time the vulva was painful, it was itchy and just sore. When I went to the toilet, it burned. I kept it to myself for quite a while at that age as well, and I would just fidget on the seat because it just hurt so much. That's my earliest that I can remember. I think my mum finally took me to the doctors because she kept saying about taking them, and I kept saying no. I was quite young and embarrassed as well, because the GP I had at the time was male, and being quite young, sort of 8, 9 years old, I didn't really want to go. I kept saying I was okay. It had gone, pretended I was okay. And then she could hear me actually crying in the toilet, because it was going to the toilet when you have itch during the night, or it's got sore, you've got little ulcers. Obviously, having urine on it, it's just like having salt in a cut. It's very painful. So trying to go to the toilet, I would just scream and just stand up and stop myself from going. I'd go in the shower to try and go to the toilet. So after hearing me do that a few times, she said, "That's it, I'm taking you no matter what." So we did go and see our GP, who's actually a paediatrician GP as well. So hoping that would help. My symptoms I gave him at the time, I did explain very well, being a child, and I just said it burned when I went to the toilet and saw itchy. He straight away just said it was cystitis. He never looked. Gave my mum the stuff to use. Remember, it being like a grainy type of cream I had to put on. I did that. It didn't really make much of a difference. It went on for a few months like that. Mum took it back again, and he still said it was cystitis. Gave me a different type of cream and some more stuff to use. Cystitis. After sort of a few more months, I didn't want to go back to the doctor again, so I pretended it had cleared up with my mum. But then as I got a bit older, the sort of symptom disappeared, which I believe now that it can quite often in children, it can clear up. Some people say it's cured, it's gone, but I don't really believe that myself. I just think that it comes back when you're older. It can obviously stop when you're younger, but it wasn't until I was in my early 20s that I noticed it came back again. I was quite sore, itchy. I noticed some blood blister spots and that, and again I sort of ignored it a bit, just thought it's cystitis. I even bought cystitis cream myself over the counter and self-treated for cystitis again. I then went back to GP, different GP this time, another male GP, who again, at the time, I didn't know that the area outside is called the vulva, so I explained it to him, which is why now I think it's so important to understand the difference between our vulva and vagina, because I said that my vagina was itchy and sore when I went to the toilet. So straight away he said to me, thrush. Again, he never looked either, and he never took a swab. At that time, I didn't realise that you could swab to find out if it was a yeast infection. I just took what he said, that I had thrush. I used the cream. It helped for a couple of days. But then it just sort of carried on again. I left it a couple more months. I bought myself some more thrush creams and pessaries and all sorts. Again, didn't really help much. So I went back again, saw a different GP, said the same thing. He then said the same thing to me, it was thrush. I was quite young, so I didn't really question it or say, but it's not working. I was just embarrassed still. Again, he didn't look. I didn't tell him to look or ask him to look, which I wish I had done. But again, I was secretly pleased he didn't ask to look, because in your early 20s, seeing a male GP, you know, you're still embarrassed, so you don't want to show them. So I was secretly pleased he didn't ask to look, but just again thought, okay, it's thrush. So again, I ignored it again. I kept seeing the adverts on the telly for Vagisil, vaginal itching. You know, I googled it myself. I just thought it's thrush. You know, it can't be anything serious, because I've never heard of anything else serious to affect the vulva. Again, still hadn't heard the word vulva mentioned by any doctor, seen it anywhere, so I was still calling it vagina. So I was googling vagina itching, so it's coming back thrush. It impacted my life in the fact that during times when it was stressful, I noticed looking back it was worse for me. I never noticed necessarily food made a difference, because I went on quite a few diets when I was younger. Didn't have a lot of sugar. I didn't notice any difference with anything I was doing. I tried to do the using different things in the shower. I wore cotton underwear. I've done all the bits and pieces myself, but didn't really make much difference. I just tried to, you know, move on really. Sexual intercourse was also painful as well, because outside the fin is the skin, it looks thin, although it's not thin. We assume it's thin, but it's not, it just looks thin. It just split and would get sore. It impacted quite a bit. I think it impacted more the fact that I didn't know what it was.
Yeah.
Understand why I wasn't getting better. Again, sort of ignored it for a few more years, and then in my late 30s, I started to get more confident in myself and my body, and also, you know, I was more assertive. So I went back to the doctors again, and this time I requested to see a female GP, which I did. She straight away swabbed me. She asked to look. I didn't even have to tell her to. She didn't notice anything out of the ordinary, but done the swab anyway to test if it was thrush. I went back to get the results. She said there's no sign of thrush. So she decided to send me for some blood tests. So I had a load of blood tests because she thought maybe it was to do with diabetes. So I went back, that was clear. She then turned around and said, I think it's early menopause symptoms, off you go. So that was it. Wasn't offered anything to take for it either, if it was early menopause. So again, I've gone away with nothing. I've obviously, over them years, I've had 8 smear tests done by different nurses. None of them ever said anything to me. Not knowing at the time, because obviously I never, although I did look at my own vulva over the years, obviously I hadn't seen others, so I had nothing to compare against. So I didn't know what I was seeing was normal or not. I thought it was normal for me. But all my skin was white and silvery. It wasn't a traditional thick plaques, which it can be with LS. It was more, made it look thin and silvery and white. I had my labia shrunk. I didn't even realise that had gone. I had quite a lot of tears, bruising. It was quite bad. So all the times I've had smear tests, nothing was ever said. So again, I'm thinking, oh, it can't be anything serious, or the nurse would have seen it, or maybe the smear test result would come back with something. Always came back clear. Then by my late 30s, I noticed that the tear I had in my perineum area, it started to get a bit bigger, and it made it quite difficult to sit down. But again, I'm thinking, what's the point in going back to a doctor? I've been so many times, so I didn't bother. I used to use pseudo cream. I tried all sorts myself over the years to help, all sorts on the internet to help with the symptoms, but just made it worse. Then in the January in 2016, I noticed that when I was sitting down and going to the toilet, it was more painful, so I had another look. I noticed that the tear had turned into an ulcer, a small ulcer. So I thought, well, that's not right. But again, put a load more cream on and ignored it. By the March, I noticed that I thought I better look again, and it almost tripled in size. It was quite big, more like a 50p size, and it was like an open ulcer. Part of it was like pink, didn't bleed or anything, and I had no other symptoms that I was aware of. So I thought I'm going to have to go back because it's making it difficult now for me to move, to walk, to sit. It was making me quite unwell in myself. It was giving me stress as well because it was so frustrating. So I went to see another GP. She had a look and said that she thinks it's herpes and that I should go to local sexual health clinic myself. So I think she saw my face was quite shocked by that. So she said, hold on, let me have another look. So she looked again and then said, how many partners have you had? I said, well, I've been with my husband since I was 18. So none. So she said, oh, actually, it might not be herpes. It could be something called vulva cancer, which I'd never heard of or even heard the word vulva either until that day. So she said, I'm going to send you for urgent referral. You're here in 2 weeks. Please go. She said, if you don't hear anything in 2 weeks, please come back. Please don't leave it. Please go. So I did. And then within a space of 2 weeks, I had 3 biopsies taken, one on the actual ulcer itself and 2 others that were in different areas of the vulva. I got my results back quite quickly. I was called in. As soon as the nurse came into the room with the gynaecologist, they put a box of tissues on the table. So straight away, I knew it was going to be bad news. And they said that it was vulva cancer and also lichen sclerosus, which I'd never heard of that either. And I put that to the back of my mind, actually, because obviously the vulva cancer took over. I went through quite a lot. The treatment I had lasted about 16 months in the end because I had so many problems. It ended up being stage 3 vulva cancer. It spread to my lymph nodes. So once I got over all that, I sort of looked back really more and looked at the left side of it. Because obviously at this point, my oncologist was so shocked that he assumed that I'd never been to see anybody. And when he found out how many times I'd been, he was quite shocked because I had all signs. At this stage, my clitoris was buried, my labia had shrunk, I was white and silvery, I had splits, tears. It was, the mess, and it had been like that for quite a long time. And I even had one smear test with the actual tumour, and nothing was said. So he was shocked. So hearing all that, I suppose I got quite angry with it all, and seeing the fact that there was no awareness for it, we're not told about it. And then I started my own support group on Facebook for vulva cancer, and then not long after that I found some LS support groups on Facebook, which is where I met Emma Norman, who we joined together really, and we do the awareness side of it together. I help admin on her LS group. We do the awareness together, like I said, the website together. We've both got separate accounts on Instagram. She's Lichen Sclerosus UK Awareness. And we just do things together really to help, because so many in the group say the same as me, that they've been misdiagnosed multiple times with thrush or even eczema, and not given the right care. So we started to help people really.
I think I probably speak for everyone watching. It is absolutely mind-blowing and heartbreaking, just the catalogue of errors that you've had to go through. And I think it makes me wonder whether this is a very particular issue when it comes to women's health, that women are routinely let down when it comes to conditions that mainly affect them, because people don't believe women's pain. As you say, male doctors, however great they may be, are not necessarily interested or don't have leather in the game to actually investigate things. But it's even, I think, even more disturbing that when you did get to see a female doctor, they didn't push it through, and you just think that's absolutely madness. Like, listening to the things that you've described, as someone that has a vulva, you can kind of feel it yourself. So it blows my mind, and I can imagine how angry you are, because it makes me fucking angry as well. So in terms of how you've managed to deal with this stuff, obviously setting up your support groups being like a massive part of, I guess, your sort of mental recovery from it. What else have you had to put in place to keep stuff together? Like, how have you been able to talk to your friends and family about it? We're talking about the fact that sex is quite a difficult thing to do when you have flare-ups. I mean, how do you talk to intimate partners if you're living with this sort of condition?
It's hard. It's for me. I think because mine turned to cancer, I think it's made it easier for me to talk about. And the fact that I was so angry that if I'd been caught so much earlier, yes, I might not have been able to stop the cancer, but I definitely would have got it at stage 1 and not left it so long. Where it's, because of that, I'm left with so many different side effects: early menopause, lymphedema, pelvic problems, bowel issues, sex issues, so many things that has made me angry. I've got all those, because that shouldn't have happened. If I'd known, if nurses are trained, because I just assumed, like many do, that nurses are trained in vulvar conditions, but they're not. They just do the smear test and that's it. Unless they happen to have heard of LS or know about it. So a lot of them know what vulvar cancer is, but again, assume it's somebody really old that would have it, so wouldn't even think of it. Some have been lucky enough to be diagnosed by their nurses, but a lot aren't trained. So it just needs to be more awareness in health professionals, I think, just as much as for us, because I shouldn't have been seen that many times. And my story isn't different. A lot of people are like me. Even on the cancer side of it, misdiagnosed with herpes and other things. So a small percentage is obviously people embarrassed and leave it a bit too long to go. But you pluck up the courage to go, and then you're dismissed that it's nothing. It's just a bit of anything. So it's difficult. So because I was so angry, I have found it easier to speak out, and I want change. It's not going to happen if no one speaks out and does anything, because that's what I want to do. Make sure no one does go through what they don't have to go through. But it's just so frustrating. So even those in the support group, we quite often, it seems to be quite rare to get a GP that recognises it or helps you or even refers you to the right place, because there's so much to it. It's an invisible illness. If you've got eczema on the face, or you've got a broken arm, or anything else, it's visible. So people can say, "Oh, I'm sorry about that," or they understand it. But something like LS, it's a hidden secret almost. A lot of people are too ashamed or too embarrassed or too scared to tell anybody, because some people do get stupid reactions from it. Some assume it's an STI and it's not. Some assume that it's contagious and it's not. It's not necessarily HPV related. It's a skin condition, no different to eczema on our arm. But some people will laugh, and when they're told, others just don't understand how difficult it is, like the mental health side of it. Obviously, people's relationships break down. I'm extremely lucky to have a good husband, but a lot of people their husbands have left them, had affairs, because it's difficult for them to have intercourse sometimes, or it makes people just don't even bother to try and find a new relationship. So even that side of it is hard, and a lot don't even tell family members, which you need to tell family members, not for the fact that, apart from the fact that it's a small cancer. Quite often when they do pick up the courage to tell their sisters or their aunties or their mums, it turns out that they have it, but they never told them themselves. So they're not sure that it is hereditary or not. At the moment, they say it's about 12% of cases, but they're not going to know because we're not talking about it. We're not telling our family members, we're not telling friends or close family about this condition. And we also hush about it in a way, because of the stigma, I suppose, and the taboo side of it. We just need to talk about, women's health more, so that, it's easier to talk about, like breast cancer is now, which weren't. So things need to change, and it needs people with the condition, unfortunately, that have to try and push to get change for it.
Yeah, completely. And along those lines, then, I guess for you and for a lot of women who LS turns into vulval cancer, the fear of, I guess, the fear of it returning is can be a big burden. So how have you managed that side of things when it comes to your mental health, and what advice do you have for other women who are worried that it might turn into vulval cancer?
Well, it's hard because, unfortunately, with women's health, like we said, a lot of GPs don't recognise it that much. Those that do, it's a fight. It's a bit like the menopause side as well of it. You have to fight with GPs to get a referral. They don't always know who to refer you to. Is it a dermatologist or a gynaecologist? But it needs to be either, but specialising in LS, has had hundreds of patients, so they can help you better. That's the main problem, I think, is that we're not all given the same information either, which is a lot of the things which me and Emma do. You know, try and drum into them that, because a lot of people are scared to use the steroid because they see how it affects eczema sufferers and psoriasis. It's not the same. The vulvar skin is different to the face, so you can use it. It's safe to use. It doesn't thin the vulvar skin. But you know, all this sort of thing doctors don't tell us, and they don't tell you even that it's a cancer risk. We lost one member of a vulvar cancer group last year. She was diagnosed with LS years ago, but was never told there was a cancer risk. Was given steroid, like some are even now, told to use for 2 weeks, and that's it, goodbye. Not told that you've got to use it probably for life, because, you know, there is no cure for LS, so you need to treat the inflammation, stop the scarring, stop the itch, scratch cycle. You know, you need something all the time, and you need to be seen all the time. And that is the main problem, I think, that we have as sufferers, is that we're not taken seriously enough. We're not referred to specialists. There isn't enough specialists to see us. The wait to see one is months. When you do see one, sometimes you're let down because they don't know enough. There's so many leaflets out there. Even the British Association of Dermatologists website, it tells you the guidelines what to do, and GPs don't seem to be doing that either. You know, you're supposed to be seen regularly.
Yeah.
At least seen for the first 6 months, seen after 2 weeks of starting the cream, to make sure that the steroid you're using is the right one for you, because there's so many. You might be given the cream where the ointment's better because of the ingredients in it. You might need a different strength steroid. You know, there's so much that needs to be done for us that we're let down by. You know, you need to be regularly seen. Once you're in remission and in control of it, then maybe refer you back to your GP. But then the GP needs to understand that they've got to regularly check and can refer you back straight away when there's any problems, which doesn't happen. So that side of it, even for those that have been diagnosed with cancer, sometimes to get a checkup, especially now what's happening, they're getting obviously cancelled, we're getting phone ones. It's just not good enough. You know, our condition is visible, it's on the skin. We need to be seen, not via phone call, not via video link. We need to come in and be seen regularly, because I even thought my own LS was under control, and then my dermatologist said that it's still active, and I didn't realise that. I couldn't tell. I'm not a specialist.
Yeah.
So we need to see them. And that would help a lot of our mental health, knowing that you're getting seen by somebody that knows what they're doing, that understands LS, that can tell you. A lot of us aren't shown how much cream to use, where to put it. Some are brilliant. Some have diagrams, they're doctors, and they show them where to put the cream, how much. Some have it on the screen so they can actually see their vulva on a video screen to show them what to do. That's very rare. You know, they all need to be, you know, singing from the same hymn sheet and given the same information so that we are seen regularly. Because it's a ticking time bomb for some people. Some aren't even aware it turns to cancer. It's very low risk. You've got to remember that it's a very low risk. It's only between 2 and 7% risk. And that's normally people like me that have been undiagnosed and left for many years, because vulvar cancer is a slow growing cancer mainly. So it does take many, many years. But, you know, it's a time bomb, because you feel like it's going to happen every time you get a lump or an ulcer. You think it's cancer again. Those that haven't had cancer yet obviously know what the symptoms are, and they're so similar. Vulvar cancer symptoms, LS symptoms, Lichen planus symptoms. There's so many symptoms that are all similar. So, you know, we're not specialists. We should be the one that can tell which one we've got or what's happening. So, you know, there needs to be a big overhaul with women's health, and more money put gynecologists, dermatologists, so that we are seeing regularly, like they are in other countries. They see a gynecologist yearly. We don't have. So, you know, we need to see it regularly so that they can check and give us all the right and the correct information. And at the moment, it seems to be, you know, people getting it from other people what to use and tips. Yes, it's great having support groups for that, but that shouldn't be the case. It should be doctors, specialists that are telling us. You know, as you can see, I'm passionate about it, because it's so frustrating when I see in the groups that they're getting told the wrong thing. You know, we're all told to use steroid twice a day, some once a day, some for a month, some for 3 months. So, you know, everyone's told different things. So it needs to be, you know, that everyone's saying the same.
Yeah, it shouldn't be up to patients to push this stuff through, because you say we're not experts. We should be the ones that can rely on the experts to help us.
Yeah.
So I completely, I think everyone watching this feels your frustration on your behalf. It's disgusting.
it's all of us in, you know, that have LS and bowel cancer, and there's many other groups, you know, like Marion said, that there's loads of different, you know, conditions, vulvar conditions, any conditions that don't really get enough awareness anyway. But, you know, lichen sclerosus can turn to cancer. It's not this. I know it's, you know, my husband has psoriasis. You know, I know how that affects him, but it doesn't turn to cancer.
Yeah.
LS does. But even LS, you know, there's not enough about it. It should be all over, you know, doctor surgery walls. It should be everywhere because, you know, there is a slight risk. And like you said about how many people, there's not even definite on how many actually have it, because some say it's rare, some say it's common. It's just not recognised. That's all it is. And I think the reason why the age limit as well, because doctors, I think, read up on it themselves and they see it's post-menopause women that are diagnosed, so they think you're too young to have it. Children can have it, obviously men can have it as well. So there is no age limit, but I think doctors assume that you've got to be over 60 to have LS. So I think they just ignore it until you get to that age. And I think most people are diagnosed at that age. So that's why the age at the moment they're saying is around menopause age, because that's how long it takes a lot of sufferers to get diagnosed. Because a lot don't even know they've had it or got it. You know, I truly believe if you've got it now, you've had it for a long time. You might not have had any symptoms, because there are so many symptoms. You don't necessarily have to have all of them. If you haven't got the itching or the white patches, some GPs won't assume it's not LS, but you don't have to have white patches or itching. You know, there's so many symptoms that you just have to, you know, try the steroids, see if it works, try different ones, or have a biopsy, which a lot of gynecologists and dermatologists they do now. But I understand that it's hard to get diagnosed, but, you know, we're not even listened to.
Yeah, totally. And so I was going to say that now we should give a couple of minutes over to people asking questions, but I see that
Yes, Emma has, yes.
Everyone's asking all these questions. They're being answered so wonderfully in the comments. So,
yes, Emma is on there for us.
Yeah,
and making sure I don't say anything wrong, because I have it a word.
She's doing a great job. I only had two things to ask you then, which I was going to say, anyone watching this, look in the comments, because there are links there to everything that we're talking about, and advice from British Skin Foundation and Claire's organisation, and we'll put all the links on our website as well, Lichen Sclerosus UK, everything else, so they're all there. But two questions. One is, if people are worried that they do have LS, how important is it that they say they want to see a woman GP?
It's up to them really. So some people are happier just to see a male GP. Sometimes male GPs are even better than female GPs. Right. If you're comfortable and to ask them to look, then, you know, have a male GP.
Yeah.
But some aren't. You know, that's why I think that, you know, training nurses. Because I noticed them has put up the Eva Pill online training that finally happened last year. You know, nurses, if once they're trained in it, I'm sure a lot of people will be more happy to see a nurse, or while they're even there having their smear test, while you're there, check the vulva, and you can discuss it then. So you know, you just need to be, you know, more certain really, and just say, look, I think it could be lichen sclerosus. You know, I've got all these symptoms. Could you please refer me to a specialist? Yeah, the best thing is to find your own specialist. You know, look yourself, Google the area, look up specialists, look up, because, you know, now we've got Google, we can find out about all the doctors, what they do, what they've done, what they specialise in, and then go in armed with that, your GP, and say, look, I want to be referred to a specialist. I can't take this anymore. You know, I've got these symptoms. I want to have a biopsy, or I want a specialist that recognises LS and that can help me, and then ask to be referred to them.
Fine. Okay, so it's all about being an advocate, feels basically pushing until someone listens to you. And my second question is, what sort of, I know it sounds kind of trite given the seriousness of this, but what kind of acts of self-care do you do that do make you feel better mentally and physically? Like, does having warm baths help, or are there, I mean, how do you look after yourself from a holistic point of view?
Well, I suppose, yeah, everyone's different. Some people can't have baths. A lot of dermatologists tell us not to, because they say that bath water is drying. You should only have showers, but some do still bath. Also, some people put Dead Sea salts, different type of salts in the bath, which helps as well. So yeah, it's just finding what works for you. A lot of people use Headspace app to help them. You know, it's sort of talking to people. What helps me, I suppose, is obviously my family, but also talking to Emma quite a lot. We have quite a laugh talking, you know, while we're doing the campaigns and making pictures. We have a laugh, and that's how I think it helps me, having that, and having, you know, putting my energy into what I do with awareness helps me. But you know, you just got to find what helps you. You know, all different things do.
Yeah.
Because not everyone's different. Everyone's LS is different as well. It could be mild to, you know, to severe. So you've got to find what works for you. Again, the support groups help there, because our one, you know, there's loads of tips on there. Anyone who does think they have got LS or has got LS, then if you go onto our website that Emma put up, which is lsbc ukawareness.weebly.com, all our awareness pages and all our support groups are on there. Come into the support group, because it's harder for me to do it on Instagram grids, but I do so much more in the actual groups. Loads of articles, we've got webinars, we've got, you know, the forum you've done with British Skin Foundation, we've got the Vulval Pain Society have done webinars for us, all especially talking about LS. So all that's there for everyone to look at and, you know, to get help and advice for, especially with emollients as well. No one knows what's the best emollient to use. A lot of people don't realise that you should use it throughout the day, that it's not just to wash in, it's a moisturiser and a barrier. There's lots of great, you know, helpful tips in the groups, like, to help everyone.
Yeah, fantastic. Okay, so we will put all the links on our site when we save this, and we'll make sure that everybody has access to them, so we can take the conversation onto there. But just to remind everybody that we had an LS online expert clinic where people were like experts were sharing their advice as well. And obviously give Claire a follow on Instagram. She's got loads of information on her page and on the LS UK page as well. So Claire, we'll wrap it up now, but that was, I think that was probably the most frustrating and informative Instagram live we've had so far. But thank you so much for talking to us and being so honest.
Thank you for inviting me on. And
it is an honour to have you, like, working with us in this kind of stuff, because it's amazing to see someone so passionate. I think you'll give so many women hope that there is people can look forward to a life living with this condition under control, as you've proved. So I can just say thank you so much for spending tonight with us.
Well, thank you for having us on and helping to raise awareness.
All right, see you later.
Thanks everyone.
Bye.
Thank you. Bye.